We're starting with news that impacts your health, specifically your child's. Earlier today, Prisma Health held a ribbon-cutting ceremony celebrating the opening of the first inpatient pediatric rehabilitation unit in South Carolina. Prior to this new Columbia unit, according to Prisma Health, the closest centers were located in Atlanta and Charlotte, making it tough for children to receive the care they need. Our Cassidy Beyer has the story.
Starting Monday, parents and children will no longer have to travel out of state to receive inpatient rehabilitative care. Here at the Prisma Health Children's Hospital, they will now have a pediatric rehabilitation unit, the first of its kind in South Carolina.
To see what Naomi had to have intensive pediatric therapy, but she had it at Levine's Children's Hospital in Charlotte, so we had a lot of traveling to do.
It's been more than a decade since Naomi Johnson's near drowning resulted in a traumatic brain injury.
My wife had to stay with Naomi at Levine's Children's Hospital. I had to come home to take care of kids. So I would go up there sometimes 2 or 3 times a week, and on the weekends, it was just tough.
The Johnsons made it work, but that's not always the case. According to the Director for Pediatric Rehabilitation Medicine at Prisma Health, Dr. Colleen Wunderlich.
Up to 50% of our South Carolina teens and children did not have access to these much-needed services because overwhelmingly there were no beds to be had out of state, or families could not travel because they had to work or take care of other children, or maybe they just didn't have reliable transportation to get to Charlotte.
The Rehabilitation Center at Prisma's Children's Hospital will treat children that have been through traumatic brain and spinal cord injuries, as well as life-altering incidents here in the Midlands, and will include
our fully private rooms with overhead patient lifts on both sides of the beds that go directly into the fully accessible bathrooms. We have a state-of-the-art gym that was specially designed for children and adolescents. There is a Snoozlin multi-sensory room that will help calm our traumatic brain injury patients and also stimulate them. And we also have a hallway walking system that is the final frontier to independent walking.
The inpatient rehabilitation unit took roughly 11 years to come to fruition. And according to the Senior Medical Director of the Midlands Prisma Health Children's Hospital, Dr. Kaufman-Taylor, was financially possible thanks to donors, the Department of Health and Human Services, and the South Carolina Children's Collaborative.
We have something called the Children's Hospital Infrastructure Fund that occurred about 2 to 3 years ago, where the legislature funded all of our state hospitals through our Children's Hospital Collaborative. The Children's Hospital Collaborative allocated 10% of that funding for a one-time support of our unit. But there have been no federal dollars. It's basically been what our health system invested and what our donors have contributed to opening the unit.
And now children in and around the state will be able to receive treatment a little closer to home.
It's really special for a lot of kids like me.
Reporting from Columbia, Cassidy Beyer, News 19 WLTX.
Cassidy, thank you. That new inpatient pediatric rehab unit is located inside of Prisma Health's Children's Hospital on the 5th floor and opens this coming Monday, June 3rd.